would get into dental. And I felt the exact same way when I started this work back in 2016. I kind of fell into it haphazardly, and now I'm in my 10th year of working for mental health resources and working on our dental initiative, among other things. So I feel like what you're saying, Nancy and Tessa, Jane, like you get into this field and or this like topic area, and it's hard to leave because it is really important work. Um, so thank you for being here. I hope if you have questions, please unmute or put things in the chat. I have to say, a lot of this is speaking from my experience in my role at MHR, but I'm not an expert in all of this. I've never worked in a dental clinic. I'm not a dental professional. So if you have ideas or feedback or questions or whatever, like please share that, speak up. I like a conversational easy, uh, presentation. So, so who am I? My name's Jordan. I have worked at MHR for for a little over 9 years, and my interest in dental actually is kind of funny. I won't spend too much time on this, but in fifth grade, I fell on the jungle gym and I knocked my front two teeth out. And they were, fifth grade, they were my adult teeth. And so they were able to kind of get them back up. They're crowns now. But in fifth grade, they did a most likely to whatever. And I was voted most likely to become a dentist. So that started, 20, I don't know how old you are, 25, 30 years ago. I don't know. And I'm not a science person. So like do not like that direct sort of science. So I just kind of fell to the wayside and something I totally forgot about for a long time. And then I got into this work. So I feel like I'm living out that calling, living out that award here now. Um, I work for Mental Health Resources. We are a community-based mental health organization. We do a lot of, we provide case management services, so targeted case management and ACT, which is assertive community treatment for adults and also now children living with mental illness. We also have a substance use disorder treatment. It, uh, Treatment up in Anoka County, and we provide care coordination services in the metro as well as up in St. Louis County. So it's a lot of different roles within MHR in the work that we do. And the dental initiative is primarily with our folks who are living with serious and persistent mental illness who are receiving case management services. So, serious and persistent mental illness includes diagnoses like schizophrenia, bipolar disorder, major depressive disorder, um, other. There's five of them, and now I'm blanking on them because I'm in front of a camera talking to folks. But it's people whose lives are profoundly impacted by the symptoms of their mental illness. And so this initiative at MHR to help address the dental needs of these folks started back a little bit before I started at MHR. We receive a grant from the Delta Dental of Minnesota Foundation, and that is how this work got started and how we are able to continue doing it. What we do is a lot of education for our case managers. So we talk a lot about the importance of oral health. We talk a lot about the impact of symptoms on ability to complete home hygiene or to complete a dental appointment. So I do a lot of training and then coordinating with our case managers. So helping them find dental clinics, navigate insurance, understand treatment plans. And sometimes I'm working directly with clinics, but most of it is with our case managers. And then sometimes it's directly supporting our clients. So that looks like attending appointments with folks, talking through what a dental procedure might look like, giving them information about how to ask for something different from their dentist, or if they're super anxious, what might they do in a dental appointment to make that possible, to make that easier to do. Um, and the intersection of just like everything, the intersection of oral health and mental health is really overlapping. If what we talk about a lot with our case managers. If you've ever had a toothache, it's really hard to do anything else. It's hard to eat, sleep, go to work, focus on anything else. And if you're already experiencing symptoms of mental illness, on top of that, like it can just be so overwhelming and so difficult to move forward with and do anything. So we're there to support folks in that, and supporting people's mental illness recovery can also support their oral health by helping people be able to navigate going to an appointment or leaving their apartment for the first time or managing their symptoms of psychosis. It makes the oral health side of things a little bit easier as well. So there's a balance here where both sides interact together and we can support both things simultaneously. So, I'm gonna identify some barriers that are unique to folks with SPMI, severe and persistent mental illness, and then also talk about some of the ways that we can make completing dental care easier. Um, and this the importance of dental care. We all in the oral health world, we know these things, but this is a lot of what we end up talking to case managers about so that we can talk more adeptly to the people we serve about the importance of oral health and dental care. Our case managers, our mental health case managers, I joke with them all the time saying, I bet you never thought you'd talk about teeth as often as you do. And they agree, like, but it is something that comes up and off. Part of it being that pain piece. And that's a big motivating factor for folks to go to the dentist is once they're feeling that pain, they have that toothache that kind of takes over everything else. But we try to move backwards and move upstream a little bit and talk about the other reasons that dental care is important. So really connecting that to overall health and well-being, preventing tooth loss and gum disease. You know, if we can do these preventive appointments, that means that the treatments that you might need down the line are maybe going to be less expensive and less extensive. And then most of our folks are navigating multiple chronic illnesses in addition to their mental illness that they live with. They're also navigating things like heart disease or diabetes, and we want to help folks understand how oral health plays into that as well. And prevention of pain and infection. A lot of times we hear, I'm not going to go to the dentist until I have pain. And so part of the conversation that our case managers are having with folks who are in that spot is like, what if we didn't have to get to that point in the first place? Like, what if we could avoid the pain altogether? So I'm someone who learns best and understands things best from kind of stories and individual experiences. So I just have a list of the mental illnesses kind of categories that I used in the dental toolkit that I wrote, which I can get to you. I think Nancy has it. We can send it out if you want that. So these are the kind of areas I focused on. I'm not going to go too in depth about um, like the actual symptoms, but I'm going to tell you about a few people that I've worked with in the past or I'm currently working with who live with one or more of these diagnoses and sort of what is going on for them and what could or has helped them in the past or currently. So depression is a thing that we hear a lot about. It's one of those it's really common. A lot of people have depression. Major depressive disorder can kind of look really extreme. If you know someone who's lived with that, it can be difficult to do anything. It's not just like I don't really like anything, or I don't find pleasure in what I'm doing. That's a piece of it. But a lot of folks, they kind of like there's a almost like physiological slowing down too. Their movements might be slower, their talk might be slower, ability to get out of bed and do basic things like eat. Or even go to the bathroom can be really challenging. Like folks with major depression, they might get more UTIs because just the act of getting out of bed, getting off the couch, going to the bathroom is just like physically impossible. So for years, I've worked with, and I'm going to change the names of everyone. So I've worked with this woman, we're going to call her Deb, and she has lived with major depression. She also has vision loss. And so um, just navigating all of those tasks of daily living were really difficult for her. And doing anything outside of the home was also challenging because of her vision loss. So she is someone who, um, as a result of all sorts of things, had lost most of her teeth, and knew she needed to get the rest of them extracted. She's someone who, when the pandemic started, or we were able to go back out into the world after lockdowns, and she was so excited about masks during COVID because she said, I can wear a mask and no one will see my teeth, and I can still smile and interact, but I'm protected. That part of my face isn't going to be seen by other people. So there's a lot of shame, a lot of just bad feelings that she was experiencing about her teeth, and then complications of like not having the, um, not having transportation, not having like the energy or ability to get out of bed, and then having that shame and stigma around her teeth. So she and I worked together it took us a while. She did not have any dental coverage because she only had Medicare insurance. So we worked together because MHR has some dental funds, has some funds to be able to help pay for people's basic care. We were able to find a clinic where she was able to get her extractions taken care of, and then she got dentures. And she was amazing with all of this and so excited, and her smile was huge. And she wrote me a thank you card, excuse me, not long after she had received her dentures. And in that thank you card, she said, thank you for, all, doing this coordination stuff, whatever. But then she said, getting dentures saved my life. Um, it wasn't just about being able to eat. It wasn't just about being able to smile. There's a lot of like of her own self-worth kind of tied up in that. And that, she said, saved her life. So this impact of really just getting these really basic things met had a huge impact, not just on her oral health, but on her mental health as well. Um, I'm going to talk a little bit about schizophrenia for a minute. Schizophrenia is characterized by a lot of different things, but the main kind of symptom set to sort of think about is symptoms of psychosis, which include hallucinations. So that's like hearing or seeing, sometimes smelling or tasting things that other people can't see, hear, smell, taste. So people hearing voices or seeing a person that no one else sees. And the other kind of main component of that is delusions, and so that is like fixed patterns of thought that just don't really that are not truly happening. So a couple of people, Ahmed, again, a different name, but he and I went to the dentist together. I was accompanying him. His team did all this work to coordinate it, but he needed some support in the chair. He was scared going to the dentist. Like there was a fear, and he just needed support from another person. And this interaction is what was sort of the impetus for writing a toolkit and for having these conversations with dental professionals, because the dental hygienist that we worked with at this clinic was so fantastic. She, I I'm trying to remember her name. I knew it for a while. It's left, but it'll come back. It kind of lives with me, like her. I can picture her face because he sat down in the chair and she said, "Tell me about your routines, your dental hygiene routines." And he said, I cannot brush my teeth, but I will floss them." And he just like that said it just like that. Um, and the number of times that I've had a dental hygienist who would have been like, "Ooh," I'm like by that, or who like have a reaction to me not flossing as much as I should. Like I was kind of bracing myself, thinking that how she was going to respond was going to maybe amp up, his fears around this, or any sort of shame or stigma about what he can or can't do in his hygiene. And she just said, "Oh, okay. Like, do you have the toothbrush that you need? Do you have the toothpaste?" And he's like, "Yep, yep, yep." And she said, "Well, if it's something," she said, brushing can be really good, but keep doing the flossing. Like maybe try, if you can try brushing every once in a while, that might be." And she was just very, very kind and very meeting him where he was at. There wasn't any like, you have to be, only brush the teeth you want to keep. There was nothing that was like, even a lighthearted goofiness. There was nothing shaming or stigmatizing about how she reacted. And I could see that put him at ease. I watched him sort of relax into that appointment, and there was nothing else, that we had to worry about. So we completed that appointment. We were waiting for his ride to come, and I asked him. I said, "Hey, can you tell me about why flossing works but brushing doesn't? Will you tell me more about that?" And he said, "Ever since the FBI started following me, I cannot brush my teeth." That's his delusion. He has a delusion, a fixed thought in his head that the FBI is following him, and it's directly connected to his oral health for whatever reason. And so him showing up to that appointment and then having a provider who was so kind and warm, he started completing those appointments. I went with him for a few, and then he's been going on his own to his, like, I think yearly, whatever's covered for him under his insurance, he's been going independently because he found a clinic, because he found providers who met him where he was at and did no shaming, no stigmatizing. And it was really, really amazing. One other person I'm working with right now, he will not go to the dentist because he has a fixed delusion that the dentist will implant something in his teeth. And these are common. Delusions tend to be around like positions of power, or so like FBI, sometimes medical things, sometimes like higher powers like God or aliens or angels. Like those are kind of common. And so it makes sense that it's just a continued conversation, though. So his case managers, they know this. They work with him on it. And on our end, we're just, encouraging him to continue brushing his teeth, even though going to the dentist isn't within the realm of possibilities right now, while that delusion is really strong for him. Um, all right, I want to make sure I'm staying on time. Okay. Because I could talk about these things all day. So I won't though, I promise. I'll just share a few more stories and examples because it is where we remember these things. I
This
can
is
give you
great
numbers and
information, Jourdan.
okay,
Thank you.
good,
Yeah,
good.
very interesting stories. Thank you.
Good. Like I think in my head, like when I was writing this toolkit to finish my master's project, I was like, I need the numbers and the data and the stats, but what is more moving for most people and more memorable for most people are those stories. And we know that at like a heart level, but like, telling the School of Public Health, like, just trust me on this one wasn't enough. So I want to make sure that we get a little balance of both of those. So um, we work with folks who have a history of substance use, or are currently using substances. And right now, as of yesterday, I had a case manager reach out to me. She has an individual that she's working with who's ready to go. She wants to go to the dentist for the first time in like 10 years. She hasn't been. She has a history of meth use. And I don't know all the details on this because I'm not a medical person, but she's also been on Suboxone, so medical assisted treatment to stop using meth. But both of those things, Suboxone and meth, have had a really detrimental impact on her teeth. This individual has a lot of shame about the state of her mouth, and she is sh and I hear this often, kind of has this sense of like, well, because I use these drugs, I did this to myself and I'm not deserving. Um, and that is like that sits with people, and their experiences, unfortunately, with some dentists have kind of reaffirmed that in ways that I don't think any dentist is intentionally doing that, but unintentionally, saying things or having judgment that go alongside that treatment. And so she's ready to go to the dentist, but she's really scared to like nervous about finding a clinic and finding a dentist who's not going to add to that shame and stigma around her history of substance use. So I'm working with her case manager to find her insurance, and we're working together through her insurance to connect to a provider and seeing what other supports are there for her. Because I think that all dentists are wanting to do their best work and serve people as best as possible. And sometimes it's just not like there's not a familiarity with how those kind of normal things that you might say or do could like impact someone. Like I keep saying this, but like, don't only floss the teeth you want to keep. Like that, like lives in my head as something silly that a dental hygienist said to me one time, but also like made me feel really like freaked out about not flossing my teeth. But then like I live my life and I don't remember, and I have a 17-month-old, so I don't floss my teeth. So I'm like, oh my gosh, do I not want to keep my teeth? Like, is this up to me? Like, what's going on? It's just, and I'm someone who like I don't have tooth loss or damage from substance use. And so I think of that kind of benign comment as something that stuck with me. And I think that's the same thing that happens for the folks that we serve at MHR and for folks who have had maybe a history of substance use or mental illness. So that's just something that like we're navigating together. What might happen, like we might find a clinic for this person, find an appointment for her, and then I will offer to go with her. Because sometimes just having another person there who can be like, oh, aren't dental, if your dental hygienist says something like that, oh, that's silly. They say that to everybody. It's just kind of like you get in your role and you say, I do that all the time. I've got things that I go back to all the time. To sort of balance that out and support that person through that appointment. That's what that can look like. And yeah, so the one last thing to think about, I know that this comes up a lot, but people who have unique sensory needs, so neurodevelopmental disorders include things like ADHD and autism, and a lot of folks have really specific sensory needs with that. Something I want to point out is we all have sensory needs. We all have things that like um, that make a situation easier or more challenging. I my husband's like, don't put on the big light in the living room. Like, don't do that. Like, it's too bright. And I will come downstairs and I'll be like, hey, it are we living in a bat cave? I can't see a dang thing. Can you turn a light up? So these are like some sensory needs. Like he doesn't like the sensory sensation of that big light overhead, and I don't like the sensory sensation of having to like really peer and look close. So when we think about sensory needs and we think about folks with autism or ADHD and how those are different, a lot of times those sensory needs are just I think of them as just a little bit amplified from someone else's experience for someone who doesn't have one of those diagnoses. So the for people with autism, for example, the experience of pain can be really amplified. They just their brain works a little bit differently. And so when you are doing a dental treatment, that pain can be bigger than someone who doesn't have autism, or needing the lights, the sensitivity to lights. People need a little bit of, they might need to wear sunglasses the whole time. Do you have those there that can just like help them out? And so we work with a number of, especially our children's case management clients. A lot of them have autism, and some folks can go to the dentist with some extra supports. Things like having a plan to bring those sunglasses, to bring your over-the-ear noise canceling headphones, to have a conversation with the dentist that you don't like the strong taste of mint toothpaste. Do you have a non-mint flavor? But we also have people who like that, like their diagnosis is and their symptoms are such that they need a higher level of support, something like sedated treatment for all of the things, because getting even like into the chair isn't going to happen. So, those are just some of the like examples of how these symptoms sort of show up. Other barriers I want to talk about quickly is the a lot of our folks at MHR have MA for their insurance, so medical assistance, Medicaid, and we struggle to find dentists who take MA. And I know that that is not new information to anybody here. And then the other side is then finding an appointment. You find that dentist, and then it's like, hey, this is really far out. Something we talk about, though, that I've been talking about with our teams, has been that that's true for everybody, that there's dental assisting and dental hygienists like shortages. And so getting an appointment, especially for a cleaning anywhere, regardless of your insurance, can be really challenging right now. So normalizing that too, of like, like we're in this. People might be ready to go, which that's the hard part. Like you're ready to take action, and then you have to wait 4 months. But we talk about that. We try to say like this is where we're at, and here's how we can support you with that. Um, Transportation is a huge issue for our clients, being able just to get places, and it makes sense. A lot of clinics have late and cancellation or no-show policies. I totally get that being necessary, but sometimes like the transportation piece, folks will get there and they'll be just at that cutoff, and then that happens 2 times and then they're fired from the clinic. Like what can we do? And I don't know the answer to this. That's the other side of this, is it's a conversation and consideration for dental clinics. You have to have those policies in place, but could they look a little bit different? Can there be a way to schedule in some flexibility? And it's just things to think about. Again, I don't know the answers, but that definitely happens to our clients. Like we talked about mental health symptoms, and then stigma, both around having a mental illness, and stigma on being on state insurance, and stigma related to oral health issues. So our folks are kind of up against a lot in that area, and I think that's a place where um, providing like a compassionate, empathetic environment can start to like bring down some of that stigma of really approaching people um, with warmth and normalizing like, hey, it's okay. Like, or like that dental hygienist of the person that Ahmed, that we went to the dentist together, and she was just like, okay, like let's move from there, instead of like, you're supposed to brush your teeth twice a day and floss once a day. He probably knows that. He's in his 40s. Like he's probably heard that a lot. And he probably feels weird about how different his home hygiene routine is, but she didn't contribute to that at all, and it really supported him. And then competing priorities, just like everybody, we all have a lot going on. There's a lot to navigate, and some of our clients at MHR have housing insecurities. They have kids. They have just like everybody. They have jobs, and like getting to the dentist is lower on the priority list. And like I mentioned at the beginning, like people kind of get into that space of like, I'm just gonna wait until I have pain. Because I am really busy. I have so much stuff going on. I'm not gonna do that. This is where like on our end, as mental health providers, our conversation is like, well, what if we can avoid that in the first place, and helping prioritize a little bit more the preventive care. All right. Let me just look at my notes quick. All right. So in the toolkit that I put together, um, uh, the first like 2/3 are kind of talking about mental health symptoms and their impact on home hygiene, as well as completing appointments. Um, Excuse me. And then the last third or so is just exploring a few frameworks um, for providing care that I don't think are really taught in. They're taught to social workers. They're taught to our the folks that work in the mental health field, and they're beneficial, I think, across the board. But they're not like the standard thing. You're learning, I don't even know what, a million other things as a dental student. People are not probably spending, if you do learn about this stuff, it's probably a small subset of a much bigger curriculum. And so I think that you don't have to learn these whole things. You don't have to become an expert in motivational interviewing to take some of the skills and some of the like the spirit of it into your practice and into your work. So I'm gonna start with person-centered care. And I like this one because it just names it as it is. It's really putting the individual at the center of care. And one of the one of the biggest kind of pieces of this framework that I think can help in a dental setting um, is the focus on the strengths, the motivations and the resources that the individual has. That is the provider's job, is to focus on those things in creating treatment plans. So, I'm going to keep going back to Ahmed and his experience with that dental hygienist. She focused on his strengths in that he was flossing his teeth. He was doing something that is a strength. That's awesome. And she was building on that. And his motivations, she didn't necessarily like dig into that, but like, she was able to sort of assess like, do you have everything you need? You're not like not motivated by not having the stuff you need. You have all that stuff. And then and his resources too. Um, I think for the resources conversation, a lot of times, um, we have clients, I'll receive treatment plans, from dentists for our clients who like 90% of our clients have Medicaid for insurance. We will get treatment plans for multiple crowns that are not covered by insurance, or even treatment plans for dental implants or other things that are very much financially out of the realm of possibility for the folks that we serve. And that then leads to sometimes really tough conversations with clients of like, hey, the MHR, the dental funds that we have are so limited. I wish we could help you with getting all of this, but it doesn't take into account the resources, the financial resources or the insurance coverage for folks. And then we end up like sending people back and saying, "Hey, um, here's your next step is to ask your dentist what is the treatment plan if I can't do this?" And so we've actually worked with another clinic who has whenever they see someone who comes from who we are like, hey, try out this clinic, and they tell the clinic like, hey, I'm from MHR, I'm a client of MHR. They have understanding the resources and the needs, the insurance coverage and the financial resources of our folks. They have stopped like kind of upselling or like going to the highest, most expensive treatment plan. They have really narrowed it in. And if it has to be something more expensive, so if it's a denture that is not the cheapest denture, but it's the next step up, there's usually an explanation as to why that is. So then we can coordinate and work together on it. But I've really appreciated that clinic's willingness to sort of shift their practice to take into account that resource piece. So really building on strengths, understanding people's motivations. Is your motivation to stay out of pain? Like then let's have let's have your cleanings, like get those done, so we can catch anything anything before it becomes painful. Is your motivation to get your teeth extracted? I worked with one person, she's like, I'm just so sick of dealing with my teeth. Like they're in really bad shape. I keep getting treatment plans for crowns. She's like, I have some money I could use to, but she's like, I would rather just not because I'm constantly having to do this. Her motivation was to like treat her whole mouth and just get dentures and be done with it. And that's totally, totally fair. And there's people who don't want extractions at all. It might not be possible, but having those conversations and understanding the motivations is really helpful. So that's person-centered care. It's really, um, aside from that, focusing on the individual's strengths, motivations, and resources, it is a framework of partnership and collaboration. It's understanding the individual and collaborating together. So the idea that the person is, they are the expert on their own lives. And so how can we draw out what those motivations are, what their strengths are, and what resources they have or need. Um, the next one is trauma-informed care, which is there's a ton that goes into trauma-informed care. I'm sure you all know that. You've probably all heard of this. And I think two of the things that are um, really important from the trauma-informed care lens is really having safety at the core of the appointment. So that safety, like, your regular safety things, wearing gloves and masks and stuff, that's happening. But really thinking of the individual's like psychological safety, and helping them to remain safe in that space. The dental setting can be really activating for people. You're in a chair, you're reclined back, you can't get out of it, and then people are putting their hands in your mouth. And that is just like, that can just be so activating of all sorts of different experiences of trauma. And because you feel out of control, you feel unsafe, you don't know what to do or how to communicate. And that can lead to fight, flight, freeze. That can lead to people maybe like freezing, completing the appointment, and then never coming back. It might lead to, someone reacting really strongly. There's a lot of stuff that can go on. So, how can you kind of avoid that? One thing, I've had a dentist once. She was really great with saying like, kind of stopping along the way with me. And I didn't request this. This was just her practice, but she was like, okay, here's what's going to come next. Like, is that okay? Or like, here's the plan. Here's what my plan is. So I knew what to expect in the moment. And I knew kind of what was coming next. And then she'd say, do you need a break? It was just kind of checking in as she went, to take like any opportunity for that like fight, flight, or freeze. It was alleviated by those pauses and check-ins, and it put that control of the safety back in my court. It let me decide like, yep, I am ready to move on. Or you know what? I could use a break for a minute, or can I sit up for a second? It can be really small shifts like that, but helping that person who might be really activated or triggered by that setting, um, to respond and answer. And so that takes, I think, takes some practice to assess with a person like in that time, but really as much as possible, kind of putting that um, back to that individual, that safety as they define it. And then empowerment and choice. That's kind of goes back to what I was saying with the dentist that I was working with, where she was empowering me to say, like, I need a break from this moment. Like, this is too much for me. Even though it was just a regular old exam, she was just like, I don't really know what all she was doing. And I'm the kind of person where I'm like, don't, just keep going, just keep going, just keep going. But some people might need like, yeah, actually, like, I do need a break. And I have a toddler, so like co-regulation, like as the provider stays calm, as she offers this sense of safety to me, she's a safe person. She's staying calm. She's not activated by this setting. She's noticing that maybe like I'm getting a little, so she's just like checking in with that. And so that helps her staying like regulated in that moment helps me then stay regulated in that moment. So and that gives that empowerment, that choice to move forward or not, on that individual. All right, the last one, the last sort of framework is motivational interviewing. Motivational interviewing is a really kind of complex but collaborative counseling style. And people who are like experts in motivational interviewing are amazing to like watch them work through this. I think it takes years and years and years of practice to be a really good motivational interviewer, to use this style of counseling really well. And while that is true, all of us can use pieces from it in the care that we're providing. We can all use pieces of it um, in our work, and it can help make settings that might be stressful a little more easier to navigate for both the provider as well as the patient or the individual. So there's something called the spirit of motivational interviewing. There's a lot that goes into it. Of course, I'm giving very high level information here today, but three of the things that I think are really important of that spirit of MI are partnership. So you're coming at this together, or something that they say in MI is like you're coming alongside someone. You're not, pulling them along or pushing them forward. They're moving in a direction of a goal, and you are coming alongside them in that. You're partnering together, and together you're going to move towards this goal, whatever that is. Acceptance, kind of radical acceptance of who the person is, where they're at, what they need, and maybe the path that you need to go down is a little bit different, and accepting that as true. Again, going back to Ahmed's story, acceptance of who he was as a person, his unique dental hygiene routine at home, and acceptance that like the path of that appointment maybe looked a little bit different for her because she got that information and she accepted it and just moved with it and moved with him to successfully complete that appointment. Um, and then compassion. I think we just can't have enough compassion and empathy in our interactions with whether it's with patients, clients, or just with each other. I think that is a huge thing to have some to remember that, especially when things feel trying, to like call back into that empathy, call back into that compassion that you're having and showing with and for other people. So those are kind of some of the spirit of MAI that I think are really important. And then there's a few they're called the ORs, and I like an acronym because it helps me remember. But the ORs in motivational interviewing are open-ended questions, affirmations, and reflections. So open-ended questions are not yes or no questions. And um, you can get to a lot more information by um, asking an open-ended question. So instead of saying, do you brush your teeth twice a day and floss once a day? Or, like whatever. People are like, yes or no. Okay, that's fine, but you're going to get more information if you say, possibly, if you say, like, can you tell me about what your home hygiene looks like for your oral health? Or um, can you tell me about how it is that you came to this clinic today? Or like, what is it that brings you in a way that's just like really curious and compassionate? Um, and when something is surprising or people are like, yeah, I don't floss. Nope, nope, don't floss. Like, can you tell me more about that? Is just it's an open-ended question. We hear it a lot, but sometimes it is easier to just like ask the yes or no and get through our list and move forward. But when we need more information, getting that open-ended question can help us get there. Um, Affirmations are not just repeating of like what someone says, but like affirming so with them at affirming like, oh, so you only floss your teeth. Okay, like that's great. Or like, okay, like what can you kind of are repeating back, but sometimes adding something else in. Like you said you can't brush your teeth, but you can floss them. There's an affirmation kind of what was said, or a reflection. Um, or that's a reflection. Anyway, there's affirmations and reflections. So they're kind of similar, but affirmations are like, you can do this, you're only flossing your teeth. It's really great that you have a um, home hygiene plan that works for you. And then reflections are not just repeating back, but can add meaning. So you don't brush your teeth uh, because you're too busy. And then the nice thing about reflections is when you get it wrong. So I venture that guess. I say you can't brush your teeth because you're too busy. People will correct you. A lot of times with things like affirmations and reflections, especially, people are hesitant to do them because they're worried, like, well, what if I say the wrong thing? What if I add a little bit of meaning or like venture a guess on how someone's feeling and it's wrong? You almost want to get like, I think sometimes you get more information back when you guess wrong. So I think that's just an encouragement to you. So the ORs are the open-ended questions, the affirmations, and the reflections back to that individual. Oh, um, this is what we share with our clients or with our case managers. I think I meant to take this slide out, but we can just look at it quick. We talk about anxiety because even if you don't have an anxiety disorder, a lot of people are really anxious about going to the dentist. And so we talk kind of from the top is things that are like free and easy to do down to like most expensive, maybe most challenging to do. And we try to have conversations about what else is possible. So sometimes I'll get a case manager who says, so and so wants to be sedated for all of their dental things, and they hate the dentist. They just like knock me out, do my cleaning, do my fillings, and I don't want to know about it. Just like do this. Well, that doesn't really like that's not covered by MA. Like I can't think of any dentist who will do that. So like that's not really an option. What else is possible? And so we kind of I always encourage people, if they have any anxiety, to just start with that communication with their dentist, to tell them when you're scheduling, tell that person at intake, like, hey, I don't want to be here. And sometimes our clients are like, I don't want to hurt the dentist's feelings. I'm like, Trust me, the dentists have heard all of this and more probably. Like it is not, it's not a surprise to your dentist that you are anxious or don't want to be there. Um, and when dentists say like, when they are affirming of people showing up and being like, it doesn't matter how long you've been away from this dental chair, we want, I'm glad you're here now. And that dentists are happy to see you. Dentists are glad that you are there, even if you're not like thrilled about showing up. And so the more that dentists do that, the more that that sort of like affirming environment happens, that rather than being like, yeah, geez, you should have come. It's been 10 years. Um, just being like, yeah, you're here now. So we sort of start with the easiest and then see what else we need to layer in if and where it's possible. And sometimes it's just not the right time for people and that's okay too. So we also know like we're not going to get to 100% of our clients going to the dentist every year. It just isn't going to happen. Um, and we're there to provide that information. Our case managers are there to continue to have that conversation and just to know that they're supported and encouraged to do what they need to do. Oh, and this is another slide I think I meant to take out, but it's something that comes up all the time. And so we say like pain is rarely the first indicator of a dental problem. You know, by the time your filling hurts, that's going to be a bigger filling than like when it's just a little spot that you can't even feel that you didn't know you had. Like I've gone to the dentist before and they're like, "Oh, you got to do a filling." It's like, "What?" Now my mouth hurts worse after going to the dentist than before I went. Like, I totally get it. Why would you want to go to the dentist for that? Well, it's gonna, prevent future pain. And then mental health symptoms and medications can increase those oral health needs. So a lot of antipsychotic medications, I think, and some other brain meds basically cause dry mouth. And so, in addition to like symptoms getting in the way of people completing home hygiene, dry mouth is a really common thing that folks experience. Some cause clenching of the jaw. So, like, really knowing that medications have that impact is another place that where we encourage folks, like, hey, like, we know that you feel good about going, like you're okay with how your teeth are, but like let's go get it checked out because your medications might have an impact on that. And then physical health and comorbidities can really add into that. Folks who have diabetes or heart disease or any of those things, really encouraging people to understand the intersection of that and the impact, and then encouraging people to go. And that's there. I just talked for like a long time at you all about something that I feel really passionate about, but what questions do you have? What feedback do you have?
So Jourdan, I just have a question. As I was reviewing some of your slides and I had commented to Nancy, I thought I did it to the whole group, but have you ever considered doing like some kind of resource handouts with some of those slides? I'm thinking particularly the one where you're, telling people to make sure you communicate and consult with your dentist, to bring someone with you. Those are great ideas or suggestions that could be made into a nice little resource for people that, show up at the medical office or, at the Head Start office or, anywhere. So just a thought about that, but that's
Yeah, I
great.
I have one and the reason that like it's in the slide like that is that it looks really dated. I was like, I need to update this because I probably made it in 2016 or 2017. So it's I want to make it into a one page, but I can do that. And once I have that updated, I can send it to you, Nancy.
Yeah, that would be great. We'd love to share that. We could put that on our
Cool.
website too. Um, yeah, we have 5 minutes. Jourdan, is the toolkit readily available? Is it something we can share with dentists?
Yeah, I will email it to you.
Okay. Would you,
There's not anywhere like electronic that it exists on my end, but I have a PDF that I can send to you.
I'm happy to put it on our resources page and you
Awesome.
could just, I mean, I'm happy if you want to just send people there, I can send the link to our membership. Um,
Great.
and probably the people on this call as well. Um, but yeah, if you want to send that to me, I'll put it on our resources page. And as long as you want to, just send people there. It's fine. I can give you that link.
Awesome.
Yeah, I had so many comments. I wrote a bunch of notes and there's some really, really good comments. I didn't see any questions, just a lot of thank yous. Um,
Yeah, somebody had asked for a link to the, or to be sent the dental toolkit, so that would be great. And
Awesome.
in addition to sending it to dental professionals, I think it would just be great for all of us in general, whether we're a dental professional or not, because um, a lot of these things, these are kinds of things Nancy and I have been working on, and the Early Childhood Dental Network has been working on,
right.
making sure people keep those appointments, even if, or at least communicate with their dentist. There's such valuable, spaces for appointments that we don't want people to just not show up. So,
Mm-hmm.
And
Mm-hmm.
and I know you mentioned it at the start, but I want to thank Delta Dental and Minnesota Foundation for the funding because this is really important, mental health and oral health. I've talked to so many people. I know I talked to Sarah Wovcha from Children's Dental Services about when they work with people who are new immigrants, right?
Mm-hmm.
And just people in general, not everybody feels comfortable with someone this close to them. I mean, they don't have to be a new immigrant. They could have
Yep.
been born in Nisswa. But just those, there's a lot of the issues with how close people are during dental care, the mouth. Um,
Mm-hmm.
and yeah, some of the comments that I've been reading and is, we love your energy. We feel your passion. I'll speak for me. I feel your passion. It's just I took so many notes. I love you were talking about motivational interviewing. Like I think you said, even if people use pieces of motive, they don't have to be an expert, but those pieces are helpful. Meeting people where they are, um, you know, yeah, just the flexible scheduling. You and I can talk about this offline, but
Mm-hmm.
we do have some clinics that have been working with flexible scheduling.
Awesome.
Um, So I'd love to share that with you because maybe that's a model, we can share with more clinics. But just
Nancy,
remembering that not everybody can get there at 8 o'clock
Right.
or
right.
10 o'clock on the dot. So,
There is one question in the chat, Nancy, from
oh,
Sylvia at Centricare.
oh,
Do
good.
you serve all counties in Minnesota? It says. And so,
No, our case management services are in Hennepin, Ramsey, and Dakota County. Um, and that's most of the folks who take advantage of our dental initiative are in those counties. We have some care coordination clients in St. Louis County. Um, and our substance use disorder treatment is in Anoka County, but it's mostly those three metro counties. So,
Well,
okay,
and
thank you.
yeah, thanks. And then hopefully through us sharing your information,
yeah.
people in the other counties and yeah, Sylvia, let's keep in touch. It'd be great
Yeah.
to connect everybody so we can share those resources. Yeah, we have a minute left. So again, thanks so much, Jordan. We really
Yeah.
appreciate it. I got a page full of notes. I love it.
Awesome.
Um, thanks to all of you that were here, and we'll get this on our YouTube channel. And bye, John.
Thanks,
We'll
John.
get this on our
Yep.
YouTube channel and share the resources. So thanks again. It's been wonderful. And
Thank you. Thank you all.
yeah, we
So,
we won't be here next month, so
no, we won't be
we'll
here,
send
but
a
we'll
note
be
out.
keeping resources, we'll keep resources flowing to you. So, all
Absolutely.
right.
All
Thank you,
right.
Jordan.
Awesome.
All
Thank
Yeah,
right.
you.
thank you so
Bye.
much.
Bye.
Bye, Sylvia, Ariana, Andy. Bye, everybody. Bye, Michelle and Tessa. All right. Bye, folks.